Swayam Prabha. Digital India. Educated India.
Hello dear students, I am Dr. Mona Semalti from HNB Garhwal University, Srinagar, Garhwal. I welcome you all in this module, and today in this module we will discuss different types of skin problems and their solution or their treatment. What is the treatment of different types of skin problems? So this is in continuation to our previous modules on cosmetics and cosmeceuticals. So dear students, let's see what are learning outcome of this module. After going through from this module, you will be able to know the causes behind the dry skin and what is the remedial part of the same, as well as the causes behind oily skin, dermatitis, what is dermatitis, what are causes, and what is the remedial part or what is the treatment of the same. So this is going to be our learning outcome. And we will be following this lesson plan. So first we will see dry skin, oily skin, dermatitis, their causes and treatment part. So first let me tell you dear students that normal skin, what a normal skin is. See, the normal skin in term is used to describe that is well balanced, means it is not too oily or is not too dry. The balance between oily and dry skin is considered as normal skin. So generally, normal skin types have an even balance of sebum production. Sebum production means the natural oil which are secreted by the human skin. Okay, and sebum as well as the oily and waxy material that lubricates and waterproofs the skin's surface. Right? So normal skin has stronger barrier that helps in locking moisturizer. So this is what is about normal skin. What is normal skin? It has balanced sebum production. Okay. Now see, first we will see skin problem, that is dry skin. So dry skin occurs when skin cells produces less sebum or the natural oil than necessary. The amount of sebum production, if it is less, then we state that the dry skin is because of that reason. And this lack the sebum result in the skin feeling tight with a dull and rough looking texture. So water content about 10 to 20% in stratum corneum is required to keep the skin soft and payable. Okay, so the barrier alteration causes increase in transepidermal water loss faster than replacement by underlying tissues. So this is about the dry skin. So basically just remember one line that the dry skin occurs when the skin cell produces less sebum. Okay, now we will move to the causes of dry skin. Okay, what are causes of dry skin? Environmental factor. Extremely cold and very dry climates have less humidity in the air, which means less natural moisture for your skin and can ultimately lead to the skin drying out. Okay, ultimately lead to the drying out of the skin. So this is one cause, environmental factor. And too much exposure to its UV rays causes the skin's top layer to lose moisture, and even actually it turns into a sunburn and drying. Diseases. Okay, there are few diseases which also results in dry skin like eczema, psoriasis, and medical conditions like diabetes and kidney problems. So eczema, it is a common skin condition that affect the peoples of all the ages. So overall, it is when patches of the skin become extremely dry, itchy, red and irritated. Okay, psoriasis is a non-contagious, long-lasting autoimmune condition that makes skin replicate faster than the normal, and this appears on the skin in the form of a red raised skin with silverly or reddish scars on the scales on the skin. Okay, diabetes and kidney problems, when your blood sugar level gets too high. Okay, so yellow and red brown patches can form on your skin and then it leads to the drying. Now, genetic cause. So every individual's genetic makeup is different, and a specific markers determines the health of the skin barrier function. So this is one cause. Genetically also this thing comes from genetics also, that your parents or any your parents or grandparents in your family have this problem of dry skin. So okay, now medications, it is also possible sometimes that severely dry skin is a side effect of some newly started medication. For example, diuretics and acne creams we apply sometimes, but it sometimes results in dry skin as a side effect of using these products. Now, products like harsh soap which we use on daily basis, and some cosmetic preparations also results in the drying out of skin, and frequently used skimmy baths and dehydration due to the heavy alcohol consumption and excessive sweating. So these are the causes of dry skin. Now moving to the symptoms of dry skin. What are the different symptoms of dry skin? Okay, the affected skin dull becomes dull and peeled, itchy and painful, and redness and itchiness and deep cracks, and gray ashy skin. Okay, fine lines and cracks, and sometimes they are visible fine lines and cracks, and skin that feels and looks rough. So these are symptoms of dry skin. Okay, the main symptom, dear students, please remember the dry skin main symptom is the complete dryness which you can see visibly from your eyes. Okay, gray ashy skin, redness, itching. Okay, and it is painful sometimes. Now we will move to the remedial part, the dry skin. Okay, so what one must do to treat the dry skin? Okay, shower every other day or every alternate day. So here the medical expert, they don't recommend daily shower. Okay, avoid scrubbing dry skin patches. Okay, the person should never use scrubber. Okay, avoid hot shower, that leads to the dry skin. Pat your skin dry with the soft towel. Do not rub your skin with any cloth, or rubbing should be avoided. Use a moisturizer on the skin. Use a humidifier. Humectants are used, emollients are used, and plenty of water drinking is recommended by the experts. And moisturizing soap, basically for dry skin we suggest the glycerin based or other moisturizer rich soap, and time of bath should not be more than 5 to 10 minutes. Okay, the person should not take much time in taking bath. Emollients. Now, what care one must do for to avoid the dry skin? Emollients. Dear student, emollients, these are the products, excipients or cosmetic preparations. They are because they can be applied individually. So emollients, they keep your skin smoother, soft. So applying a thin film of occlusive material as a oil or waxes makes the skin feel smooth or soft. So often it reduces the transepidermal water loss, and that water loss tends to increase the water content of the stratum corneum, and rapid reversal of dry skin condition largely attributed due to ability to fill the cracks in stratum corneum. So skin care, number one, you remember emollients. Humectants, okay, fine. Humectants, they help in keeping your skin smooth and moist. So the hygroscopic material tend to draw the water from the stratum corneum, and it holds in the intracellular rapid matrix. So water would come from the water in finished formulation and lower epidermal layer rather than the external environment. Oily skin. Now moving to the oily skin. Skin that produces high level of sebum is considered oily. High level. It depends from person to person, and it varies from individual to individual because this is the nature of the skin. So people with oily skin tend to have a large pore, giving it characteristic oily and shiny appearance, and it is more prone to comedones, blackheads. Blackheads. The comedones is the technical term of blackheads which we notice in the nose area or face and sometimes on cheeks also, and it varies from the acne. So we will discuss these problems, acne and all these problems in this module in detail. So this is little different. So oily skin looks shiny, oily, excessive sebum production by the individual's skin. Now causes of oily skin: hormone and stress. Hormone changes due to any reason, including puberty, pregnancy, menopause, and the use of, and by sometimes also by the use of birth control pill, they may cause the increase in the oil production in the skin that results in the formation of acne and inflamed acne. So these types of skin problem arise due to hormones and stress. Under stressful condition, the body rises the level of cortisol. Okay, that cortisol which stimulates the sebaceous gland to produce more oil. Okay. Moving to next, weather. Weather condition can highly influence the amount of oil produced by the skin by the sebaceous gland. Okay, humid and hot weather during the summer months stimulates the overproduction of the sebum. So however, dry weather can also cause the oily skin, but we generally notice that humid and hot weather during the summer months it stimulates. Okay, dietary choices: an unbalanced diet with high glycemic foods such as soda, sugar, refined flour, and processed food, etc. This causes the it contributes in oily skin. Okay. Now cleaning. If you are not cleaning your skin properly, so that can also lead to the oily skin. Cleaning, why it leads to oily skin? Like the oil which is naturally produced by your skin is not washed off. It's not washed off, that is why. And genetic influences, okay, fine. And comedogenic cosmetic means the cosmetics which are of not good quality and are not up to the mark standard cosmetics, which also leads to the oily skin. Okay, oil skin remedial part. Okay, what one should do then to treat the oily skin? Wash regularly. Okay, so that the excessive sebum production in your skin gets washed off. Okay, wash with the gentle soap. Alright, and warm water, little lukewarm water, and avoid using soap with fragrances or the added moisturizer or the harsh chemicals. So one should take care in selecting the soap which they are using to wash their face, and so it should not be made up of harsh chemicals or the added moisturizer, and which can or one should also avoid the chemicals which are as an ingredient of the soap which they are using, which can irritate or dry out the skin, making it respond by creating more sebum. So avoid loofahs and rough washcloths, okay, as added, because it contribute in the friction and may stimulate the skin to make more oil. Second, we will move to the oily skin remedial part, medicated acne care product. Okay, fine. So this product contains acid that tackle oily skin such as salicylic acid, okay, glycolic acid, beta hydroxy acid, and benzoyl peroxidase. So these are some medicated product which are used to treat the oily skin, and these are prescribed by the skin experts. Oily skin remedy in continuation. Okay, fine. Use a toner, because many people with oily skin use toner that makes it a that is made up of a natural astringent or anti-inflammatory ingredient. So these toners make enlarged pores seems smaller and removes the small bits of product or makeup that could clog the pores. Okay, pat the face dry. When drying the face after washing and using toner, people should gently pat their skin dry with the help of soft towel. Okay, and pulling down on the skin with a towel or using a rough washcloth is not advised, as it may stimulate the skin to create more sebum. Use blotting papers and medicated pads. This is also a remedy for the treatment of the oily skin. So blotting paper will not treat the sebum production in the skin, but they can be used to lift the excess oil of the skin throughout the day to make it appears less shiny. And a person should also try the cloth pads which are medicated with familiar cleansing ingredients such as salicylic acids or glycolic acid. So this may help in removing the excess oil. Okay, so while this remedy is also sometimes suggested. Use of facial mask. Okay, use of facial mask like clay, honey, and oatmeal. Okay, clay's mask containing the mineral like bentonite that can absorb the oil and reduce skin shininess and sebum level without irritating the skin. So it absorbs oil and it reduces the sebum level. Masks which are made up of clays. So different types of clays we studied in our previous module about. So bentonite is one example. Okay, honey has antibacterial and antiseptic, both the qualities. Alright, so a honey face mask may reduce the acne or oily skin while keeping the soft skin. Oatmeal, okay, containing colloidal oatmeal, which may also help to cleanse the skin, and then cleansing will contribute in washing out of the excessive sebum production. So that way it helps. So the oats containing gentle cleansing saponins, antioxidants, and anti-inflammatory compound that could soothe the irritated skin. Apply moisturizer. But which type of moisturizer we have to apply for oily skin? Oil-free moisturizers. For the people with very oily skin, an oil-free moisturizer could help to keep the skin moist as well as protected without the feeling of greasiness. Okay. So dear students, till now in this module we discussed two types of skin problem: dry skin as well as oily skin. We discussed the different types of remedies which are prescribed and suggested for dry skin as well as the oily skin. We also discussed the different causes of the same, both oily skin and dry skin. Now moving to the another skin problem, that is dermatitis. So what it is? Dermatitis is a general term that describes a skin irritation, and it is a very common condition that has many causes, and it occurs in many other different forms. It usually involves itchy skin, okay, dry skin, rashes on the skin, redness, we can also say a little swelling is also there with the dermatitis, or it may cause the skin to blister. Okay, so when these conditions are observed, so we considered that dermatitis, all these types of problems under dermatitis. Okay, and moving to next slide, types of dermatitis. Okay. Number one is contact dermatitis. Contact dermatitis is an inflammatory reaction of the skin to physical, chemical, and biological agents. Okay. Contact dermatitis, as its name suggests, contact dermatitis is an inflammatory reaction of the skin to physical, chemical, and biological agents. The epidermis is damaged by repeated physical and chemical irritations. Acute reaction, okay, elicited after the brief contact, so usually on hands and forearms, and it constitutes 80% of the dermatitis cases. Because of this, the 80% of the cases are of contact dermatitis, and commonly by detergent, alkalis, or solvent, or by the selection of some harsh soap and unsuitable cosmetics depending on the condition of skin. Alright, so this is about contact dermatitis. And causes we will see. This type of contact dermatitis results from contact with something that irritates your skin and causes an allergic reaction. Okay, irritants and allergen includes perfumes and some sort of jewelry of which is like nickel and other kinds of metal, the jewelry which is made up of, and cleaning product, and the preservatives in creams and lotion. That's why we say that the preservative, the efficacy of the preservative and their compatibility with the formulation of cosmetic is very important, because it may result as in dermatitis as a side effect. Atopic dermatitis, when the patient develops one or more atopic diseases as asthma, hay fever, and food allergies. So usually beginning in infancy, this red itchy rashes usually occurs where the skin plexus inside the elbow, behind the knees, okay, and in front of the neck. So the rashes may leak fluid when they are scratched and crushed over. Okay, so people with atopic dermatitis may experience improvement and then seasonal flare up and downs. Okay, so this is atopic dermatitis. Causes of atopic dermatitis are this type is likely related to the dry skin and a gene variation, an immune system dysfunctioning, a skin infection, exposure to the food, airborne and contact allergens, or by any of the combination of these. So these are the causes of atopic dermatitis. Next is seborrheic dermatitis. Okay, this condition causes scaly patches, red skin and stubborn dandruff. It usually affects the oily areas of the body such as face, upper chest and back. So seborrheic dermatitis can be a long-term condition with the periods of improvement and then seasonal. Okay, so we can also say that this type of dermatitic condition is seasonal. So you may see different kinds of ups and downs, like increase and in reduction of the conditions associated with this dermatitis. So in infant, this condition is called a cradle cap. So what are the causes of seborrheic dermatitis? This type of dermatitis is caused by a yeast or fungus that is in oil secretion of the skin. So that yeast or fungus which is itself present in the oily secretions of the body or in the sebum of the body which is produced. Okay. So what are the risk factors associated with the dermatitis? It includes, it can occur at any age group of the patients, but atopic dermatitis, it usually begins in infancy. So conditionally it can also be treated, because a person who is facing having this type of different skin problems, dry skin, oily skin, as well as the dermatitis, he or she can predict the nature of their skin, and they so that they can decide what or which kind of the treatment they should adopt it for. Okay, risk factor. This is one. Age is the one risk factor. Second is the allergies and asthma. People who have the personal or the family history of the eczema of the allergy. Okay, like allergy, hair fever, asthma are more likely to develop the atopic dermatitis. Occupation, the job, it also contribute. In what way it contributes? Like if you put yourself in contact with certain metals, solvents, cleansing supplies, so it increases your risk of contact dermatitis, because you comes in contact of certain elements or certain things which are responsible for this contact dermatitis. Okay, health condition that you put yourself in this type of condition, like seborrheic dermatitis is it is associated with the health conditions like CF, congestive heart failure and Parkinson's disease and some okay. So these are some risk factors associated with the dermatitis. Okay. Prevention. The exact treatment approach depends on the cause and the type of dermatitis, but generally the condition is managed by the following way, like topical steroids. The skin experts which prescribes topical steroids. So these are the agents, locally applied steroid creams or gel which are useful in treating the allergic contact dermatitis. Atopic dermatitis, steroids such as mometasone, clobetasol and betamethasone. Okay, these are very commonly used creams. They suppress the local inflammation and prevents the symptoms. Moisturizer, okay, useful in treating the atopic dermatitis as they help in the prevention of the drying out of your skin. So products such as calamine lotion and this kind of products are prescribed. And antihistamines, itching, swelling, redness, or we can say some anti-allergic drugs, sometimes they are prescribed based on the condition. It's completely based on the condition. Itching, swelling, redness of the skin caused by allergy, okay, so they are treated by some antihistaminic drugs. So these are available on over the counter of the product, but it must be prescribed by the expert dermatologist. Pain relievers, because it is sometimes painful. Okay, so some pain relievers are also prescribed. The patient with dermatitis conditions is always advised to wear loose clothes and clothes which are made up of cotton. They should avoid the wearing of synthetic clothes so that the skin irritation may be avoided, and any soap, which the person is using should be mild, or we also see the glycerin soap must be, and the soap should not be much perfumed or scented soap, and anything which irritates your skin must be avoided. So dear students, these are references. Just go through from these references for further reading. So let me summarize here what all we studied in this module. We started studying different types of skin problem and their solution, their treatment part. Okay, so here in this module we discussed three types of skin problems. One is dry skin, okay, second one is oily skin, okay, and third is dermatitis we discussed. Why three skin problems I am mentioning here? Because in the coming module we will discuss some more skin problems and their treatment. Okay, so oily skin, dry skin, what are the causes of oily skin, what are the causes of dry skin, and their symptoms and how it is treated, as well as dermatitis, different types of dermatitis we also discuss, and their remedial part. So dear students, with your exam point of view, the question in exam, it will come like discuss about different skin problems and their solution, or the question can be in a different form. So there you have to, until and unless it is mentioned, until and unless the specific skin problem name is mentioned, you have to discuss all the skin problems, okay, in detail or based on the marks the question carries. Okay, and few small things and few small examples wherever we quoted the example of the remedial, whether it is in remedial part or in the different types of dermatitis there we discussed. So this type of question. So dear students, just go through from this module completely. You will come to know in the beginning three problems we discussed. All right. So that's all for today, and stay tuned for more videos on cosmetics and cosmeceuticals, and thank you so much for watching this video.